Howdy ho, this is Austin over at Montana Made. Want to talk really quickly about ACLs and things we can do to prevent them, as well as the things that maybe suggest you might have an issue with one in the first place. Now, commonly an ACL gets torn when a kid lands and their knee falls inward, and that puts a lot of stress on a ligament in their knee called their ACL, and it can tear. And so they can happen from contact as well. But a lot of the times you can't control whether or not that happens. So a lot of ACL prevention is pretty much just based around you learning to control your own body. And there's a couple of things that you can see in your athletes that might suggest, hey, you're kind of more at risk than other athletes when it comes to tearing an ACL. One of the first things being the high ground contact time. What that means is, like, if you are doing pogos with your athletes and they're quick off the ground, that means that they absorb and redirect force really well. But if they're a lot slower than everyone else, they're doing pogos and it's like this, and they're spending a lot of time on the ground to redirect their force, it means that their nervous system, their muscles, don't contract quickly to deal with that high impulse of landing, and therefore they are possibly going to start experiencing this like valgus collapse in their knees. You can definitely see this if you use more aggressive, explosive plyometrics, and the higher forces within the plyometric that you have, the more valgus collapse occurs with your athlete. That could suggest an athlete that doesn't deal with those forces well. So if you're doing like quick, sharp pogos and their knees look good, but then you start going to high impulse plyos and you see their knees coming in, that suggests they can't deal with that amount of force that their body's experiencing, so they have a high ground contact time. Secondly is poor hip control. And what we mean by that is they don't know how to hinge into their hips. This is where stiff leg deadlifts and deadlifts in general can help teach loading that hip, as well as walking lunges from like more of a strength and conditioning perspective. But then when you're actually teaching jumping, teaching an athlete to land in their hips and knees and not just their knees. So an athlete that doesn't load into their hips or feel comfortable loading into their hips well might do a jump, and if you ask them to do a vertical jump and then stick the landing, they might look like this, where they're really upright and they made it very quad dominant, versus what you would want to see would be a jump and then they land into their hip structure. So their hip is taking some of the force from the ground and absorbing it, so it's not all in the knees. Another thing, a third thing that we'll see from athletes that are predisposed to ACL injuries is a bad quad to hamstring ratio. So most people's quads are stronger than their hamstrings. But let's say if your hamstring gets below 60% of the strength of your quad, that starts being a risk factor for tearing an ACL, because your hamstrings aren't helping decelerate your tibia. And so if you, there's a lot more specific ways to test this with a dynamometer, but if you're just at the gym and you know you can quad extend or knee extend 100 pounds for 10 reps, but then you can't hamstring curl 60 pounds for 10 reps, that kind of tells you you don't have 60% of the strength of your hamstrings as you do your quads. Now, all the way up to a 1-to-1, so your hamstrings being as strong as your quads, is more beneficial, but really that 60% marker is like the area where if you're above it, we worry less. If you're below it, we worry a lot more. And then lastly, conditioning. So athletes, as they get more fatigued, will start to exemplify poor motor control. So basically, inability to control their body well because they're tired. And so if your athlete isn't very conditioned, like all summer they haven't really done anything, and then they're just coming out for sport, the level of physical exertion being asked of them in that season, they haven't really developed the capacity to deal with. And so as they get tired throughout practice and a game, their motor control starts to plummet. And when they don't then control valgus, they don't hinge well, they're not quick and springy, their nervous system doesn't sense that they're experiencing a lot of force and react to it very quickly, that can lead to a higher chance of an ACL tear. Another two things, but you can't really change this, is if you're a female, a lot of the times you're just at a increased risk, somewhere from 2 to 8 times an increased risk as males. There's a lot of like physical attributes that can occur or cause that possible increased risk, but you can't change any of those, so really you want to worry about all the previous things. One thing you can change though is if you have previously torn an ACL, you were at a lot higher chance of re-tearing or tearing your other leg. So if you have previously tore an ACL and you were discharged, you kind of have to, and you're still an athlete, you kind of have to always take your athletic prowess pretty serious and take your hamstring strength serious, your hip hinging serious, some kind of continual plyometric program that you do throughout the year to maintain good jumping dynamics, and then stay conditioned so that no sport ever kind of takes you into deep water in its conditioning session within that sport or within like the actual game itself that you play. A couple of things you can then work on is just doing 2 to 3 days a week of some kind of jump protocol. You don't need to do a jump protocol every day. Most people that do that usually burn out of it or start to get soft tissue issues. But 2 to 3 days a week of some kind of jump protocol is a really good thing, working on ground contact time, loading the hips, etc. Doing a myriad of different types of plyometrics, high impulse and low impulse plyometrics, as well as trying to crush your hammies in the gym and build up your hamstring strength to match more so what your quad strength is.